Hi, my name is Anar Jamal, and I'm a dietitian by profession and presently working as a professional practice lead with Alberta Health Services in the Nutrition Services Department. So I started out as a group rep and then moved on to the local unit chairperson at the Calgary General Hospital. And I also had the opportunity to be on the board for 3 years, which I believe was around maybe 93 to 96. The term that I was on, there were so many changes. We had our Conservative government who went from many health authorities to 9 health authorities, and we changed our structure of health sciences at the same time, where we changed from being representation on council by professions to by region. So it was an exciting time because there was a lot of restructuring going on with healthcare. There were a lot of job cuts and a lot of bumping. So at that time, all our members were interested in being part of the union because they all wanted to know where they stood in terms of seniority and how they would be impacted with all the changes that were going to be implemented. So the restructuring was to align with what the Conservative government was doing at that time, where they went from, I think it was 17 health authorities to 9 health authorities. So health sciences was doing the same so that there would be representation by region. When you have 17 members representing 129 professions, not everyone is going to get represented equally, but we felt that by going to representation by region, then all the members on that region would have a voice. There were lots of other issues at that time. First of all, there was the cutbacks. There were a lot of cutbacks, and that resulted in bumping. So we all had to have our seniority dates, and then bumping was by the least senior person in your department. So there was a lot of that, and a lot of people were impacted. There was also the cutback of 5% of our wages, and I think that also impacted the members in a negative way. And it was hard for people to make that up over the years as well, because that was a big cutback. I think health sciences at the time was very supportive of its members, and they were the voice of our membership, and they made the public aware too of all the changes that were happening and how the public would be impacted. So that I feel that as part of the council and the direction of our executive officers at Health Sciences, we had a vision, and we tried to help out our membership the best that we could. I think HSAA will be doing amazing work in the future. Like, I see where we're at. Where were we at in the 80s? Where were we at in the 90s? And 2022, I think where we've come, and we're being heard, I find. You know, I always get excited when I see those commercials at night, and I go, HSAA. I just get so excited when I see all of that. And I think, where do we go in the future? I think the membership will decide where we go. I think it'll all depend on what the issues are and what is the best for the members. Like I said, the union is the members, and the members are the union. I think people shouldn't say that union, or, you know, we are part of it, and where we go will all depend on what we decide to go.